The patient experience that is most memorable, I think, in relation to organ and tissue donation is when I was a nurse on the critical care unit. I was actually taking care of a very severe neurotrauma patient. The patient was in our unit for multiple days, and I had been taking care of her, had got the opportunity to know her family, her mom and her dad, had the opportunity to have a couple of her siblings come in, really take a lot of care with this patient, and tried very, very hard to provide the best possible outcome for the patient. Unfortunately, that was not what occurred, and this patient became eligible for donation. The way our system functions is we have a donor resource team, which is a group of nurses that are specifically trained to take care of those patients. One of the things that I found that was kind of a void or a gap for me was that when it came time for this patient to transition to the donor process, I was removed as the nurse and one of the donor nurses came in. And so that was something that really motivated me because I had built the relationship with the family. I had kind of become attached to the outcome that this patient had. And so then to be pulled away or to have somebody else to step in to kind of fulfill that role really led me to pursue that passion. And so I became part of the organ and tissue donation resource team as a bedside nurse. And then when I became a manager, I actually got the opportunity to become the liaison for critical care, or the liaison for Gunderson, and really lead that critical care donation resource team. And so it's something that I'm very passionate about. It's something that I take very, very seriously. It's something that as a team, and by a team I mean our providers, our nurses, our techs, and then the teams that we partner with UW, we all take it very, very seriously because the outcomes of donation can have such an impact on people. It can have an impact on the donor families because it gives them the opportunity to see something very good or positive out of a situation that normally comes related to trauma or high stress situations. And so the fact that they get some closure or some good out of that really gives them that opportunity, but then also has such an impact on the recipients as well. It can change their life, it can change the outcome or the course of it. It gives them the opportunity to do things they may have never thought that they could do again, and it just is so rewarding. You can actually go to Donate Life Wisconsin on the internet, and then you can actually register through the state of Wisconsin. If you're not from Wisconsin, there are other ways. You can also go to the DMV, and they normally ask if you want to be a donor, and then they'll put that designation on your driver's license as well. But I do encourage people to go and sign up because then that also takes the pressure off of families, because then you are making that decision. They do not have to make a decision when it's a high stress, high anxiety, high emotional situation.